I presented the results of the SONIA trial today at ASCO. So the SONIA trial was initiated after seeing that CDK4/6 inhibitors demonstrated important benefits for women with ER-positive, HER2-negative breast cancer. First studies were done with second-line treatment with palbociclib, but soon afterwards new studies followed, both with the other CDK4/6 inhibitors, abemaciclib and ribociclib, and also studies in first line. And while the results of all these studies, benefits were seen independent of line of treatment and also independent of endocrine treatment, most guidelines adopted a first-line strategy to be preferred, although there was no comparative data to see which one would be better. So also inspired by ASCO's and ESMO's commitment to promote sustainable and equitable healthcare, we designed the SONIA trial with the idea of specifically comparing a first-line versus a second-line strategy, remembering that the CDK4/6 inhibitors also come with quite some added toxicity and considerable costs. So the study design, it was a randomized phase 3 trial in 1,050 patients, and women were randomized to either a first-line CDK4/6 inhibitor strategy or a second-line strategy. And all patients received the same backbone endocrine therapy with an aromatase inhibitor in first line and fulvestrant in second line. Primary endpoint was progression-free survival after 2 lines of therapy. And the key secondary endpoints were overall survival, quality of life. Tumor assessments were done every 12 weeks and were assessed locally according to RECIST. After solely first-line treatment, a CDK4/6 inhibitor prolongs progression-free survival with a hazard ratio of 0.59. And this is very much in line with the pivotal PALOMA-2, MONALEESA-2 and MONARCH-3 studies. However, after crossover to the predefined, protocol-defined second-line treatment, this first-line benefit completely disappears. Hazard ratio for PFS2 is 0.87 and not statistically significant. When we look at overall survival, the curves completely overlap with a hazard ratio of 0.98 and a p-value of 0.83. What we do see, however, is that those who were randomized to receive a CDK4/6 inhibitor in the first line use that treatment for approximately 16.5 months longer than those who use it in second line. And consistent with its longer use, they also experience much more side effects, approximately 42% more grade 3 and 4 events. We also looked at quality of life with validated questionnaires, FACT-B and EQ5D, at several time points during the study. Completion rate of these questionnaires was 87% at baseline and remained high thereafter. And we saw no improved quality of life with a first-line strategy, a p-value of 0.4. So we conclude that this treatment in first line does not improve your progression-free survival, it does not improve your overall survival, and it does not improve your quality of life. It does come with added side effects and about $200,000 per patient extra. So our conclusion is that the SONIA results seriously challenge the current paradigm of adding CDK4/6 inhibitor in a first line, and that endocrine single agent remains an excellent choice for almost all patients. Of course, biomarkers are highly desirable to select the few patients that might benefit from a first-line strategy. But unfortunately, thus far, these biomarkers have not been successful. We have collected both biopsies and liquid samples, and these will be studied and presented at a later stage. What's important to note is the active participation of the Dutch Breast Cancer Patient Organization in this trial. They've been crucial as a member of the steering committee and have been the true partners in our study. Without them, this would not have been a success. What's also important to mention is that the study was funded by the Dutch government and by health insurance companies. And by funding this trial, they actually saved a lot of money, as the investment for performing the study was a fraction of the savings that we made by doing the study. Post-marketing studies, post-marketing academic studies like SONIA should be performed more often to allow patients get the best and optimal treatment and to have a much more balanced and cheaper healthcare system.